Welcome. So this is going to be a discussion of roles and responsibilities for BTEC Health and Social Care, Unit 2, Working in Care. Now, I'm going to talk a little bit about roles and responsibilities. This is A1 and A2 of the teaching exam unit. I am going to cover it quite briefly, so it's not going to be a full detailed coverage of it, but it kind of hopefully gives you an idea of what we're looking at in this topic. So the first thing about this is roles. What is a role? And essentially a role is it's the beliefs, the attitudes, the mannerisms, the patterns of behaviour you would associate with a particular job, position or status. Responsibility refers to often the duties, the requirements of a professional in carrying out their role. All professionals will have responsibilities they follow, and there will be particular social policies or procedures within an organisation such as health and safety, quality and diversity, which all professionals will have to comply with, no matter what profession, field or specialism they hold. But that will be something I will talk about in a separate video. So if we look at healthcare professionals first of all and who they are and what they do. So the doctor, the role of the doctor is, there are lots of different types of doctor. So they may provide medical care to patients and surgeries. They will diagnose illness, they'll prescribe medication and treatment, they'll make referrals for patients, they'll have to maintain confidentiality and liaise with a multidisciplinary team. Nurses, again, there are so many variations of nurses. So again, these can be paediatric nurses, district nurses, community nurses, nurses that specialise in a particular illness or health. All of them are trained to carry out medical procedures, support doctors and provide treatment to patients. The responsibilities of a nurse would be to observe the patient, administer drugs and medication, carry out investigations, provide care, act as an advocate. For midwives, again, their role is to support women during pregnancy, and particularly prenatal care and postnatal care, so care for prior to the baby and after the baby, but also to assist during delivery and labour. Their main responsibilities: support pregnant women, provide the antenatal postnatal care, assist during labour, and also again it's kind of filling in that paperwork, carrying out observations, monitoring the development of the baby and women's health. Healthcare assistants are trained to provide personal care to patients, whether that's in a hospital, a care home or within a patient's home. Their main role is, and their responsibilities, is to monitor the patients, maybe take samples, carry out observations, carry out health checks, but also assist them with maybe more practical tasks like washing and dressing, or assisting with their mobility and other forms of support as needed. And last but not least, you have occupational therapists. Now, occupational therapists, their role is to facilitate recovery and overcome barriers to care. They will make an assessment on the patient's abilities and provide the level of support or arrange support plans to be put in place for them to recover. The main healthcare settings that we will look at, you've got GP surgeries, which would be your primary care, the place most people go to when they have a health concern. You have hospitals, which is often more of a secondary care system, so you generally are sent there after referral by a GP or a specialist, but you may access them directly, particularly if you went to A&E. Clinics would be part of the tertiary care system, so again, often you've been to a GP, you've maybe been to a hospital, and at that point you're referred on to another agency, and that might be a very specific or specialist form of care being provided. And last but not least, healthcare can also take place in the home. So it's provided in a household, and patients are often treated by community nurses, midwives or GPs carrying out home visits. When it comes to social care professionals, again, we have people working outside of the care sector in the community, and often they're providing support rather than medical care. Healthcare professionals are often providing a medical-based treatment. So I'm going to do the first two videos. I've got care manager and care assistant. Now, a care manager runs a care home, and that could be a nursing home, a residential home, it could be a day centre, community group, but essentially they run the day-to-day workings of that operation. Recruit staff, control the budgets, they establish the policies and procedures. Their responsibilities: to ensure the staff are trained, they provide a quality of care, records are maintained, legislation is followed, and they have the right number of staffing for the day. Care assistants are people who work in these care centres. They are supporting the patients, the clients, the people using them. And again, their routines, their responsibilities would be to carry out support, complete daily tasks, liaise with other professionals, maintain confidentiality, but it's also a responsibility for the workers to ensure they have the right training, they have the right issues and support needed to assist the patients. A social worker is slightly different. Their role is to work with people of all different ages, different needs, different ranges of support, and essentially it's to make assessments, look at their environment, make judgments on whether it's suitable to help them develop, keep them safe, and ultimately to work with them to meet their needs. Support workers generally slightly different to a social worker. A support worker will offer support to people with a day-to-day need or a particular form of support. Generally, social workers may make a judgment that someone needs support, and it'll be the support worker fulfilling the role. In the same way, occupational therapists might make an assessment on someone's ability, and then other agencies will provide the support. And last but not least, you have youth worker. So again, youth workers, they work specifically with people aged 11 to 25. Their role is to support them, help them reach a goal, encourage and monitor their progress. Generally, this may be done through projects. It might be through offering support and advice on different topics. They may act as a mentor or an advocate, but they're often working with younger people. And for last but not least, the care settings. So residential care is a setting where adults will go, or children can go, if they need 24 hours of care. And again, these users are generally specialised to provide that care. Domiciliary care, known as home care, this is the same level of care being provided, but often it's more likely to be done in a client's home than a unit. It could be short term, it could be one visit a day, it could be several visits a day. And we have daycare centres or daycare units. So again, these are often specialist centres where people with a particular need or support need can go on a day to receive that support, but also to make friends, to get stimulation, to have a change of environment. And it might also sometimes be used to give respite to carers. So there we have it. So a very brief introduction to roles and responsibilities. As I say, I will try and make more follow-up videos looking at these issues and also trying to build on this. As I said at the beginning, this is a very narrow view of health professionals and social care professionals. So do make sure you are looking at your materials, you're talking about these topics with your teachers, and also just maybe doing a little bit of research, because there are so many different healthcare professionals and different levels of support being provided. So these are always really good to know, particularly for a lot of 2-mark questions at the beginning of exams. Okay, and there we have it. So hopefully this has been of help. Like the video, subscribe, and tell your friends. So, first thing we need to think about is what are the responsibilities of care. Now, working as a professional in the care sector, whether it's health or social care, you are required to follow a code of policies, procedures, all of which are designed to protect the users of care, and it's the value care base, which was created in 1992. Now the values, or the care value base, basically sets out the right ways, the correct standards that should be used to treat people. The ultimate aim of the standards was to improve the quality of life of those using care, but also to set a standard for care providers. So examples of these care values would be sort of anti-discriminatory practice, empowerment of individuals, ensuring safety, maintaining confidentiality, and good communication. There's also the code of practice that was based around this, and these codes of practice are standards of professionals to follow. They're set out when professionals begin their role, and they're monitored by bodies like the GMC, NMC, and the HCPC. Now, those key organisations we mentioned, the GMC is the General Medical Council. They monitor doctors, consultants, surgeons. The Nursing and Midwifery Council, the NMC, would monitor nurses and midwives of all standards and levels. You might also include the RNC and other bodies focusing on nurses and midwives. The HCPC is all about the Health and Care Professionals Council, and again, these would be all other people involved in care sectors, physiotherapists, paramedics, speech therapists, and again, sets the standards for their involvement and interactions with patients. A big element of this is promoting anti-discriminatory practice. And again, to do this is also a key factor in providing care, making sure that you are not discriminating against individuals, and you're also reducing likelihood of discrimination to occur. Anti-discriminatory practice aims to make sure that the care needs of service users are met, regardless of whether they come from a particular race or ethnicity, their particular age, disability, sexual orientation. And the key thing is prejudices of staff are ideally challenged or not included in care. This has a connection to the Equality Act of 2010, and this is where a lot of anti-discriminatory practice is linked and based. Essentially, the Equality Act sets the standards, the identification of groups who need to be protected, and they are age, sexual orientation, sex, religion or belief, race, pregnancy and maternity, marriage and civil partnership, gender reassignment, and disability. So these are the protected groups. And examples of ways that you can be more accessible within health and social care to incorporate different groups would be sort of providing easy access to buildings, giving longer appointments to those with disabilities, using different types of signage, leaflets in various languages, providing alternative hospitals and clinics for people who can't get to them, or allowing family or friends to go with an individual if they are uncomfortable in that situation. The key aim of all this is to make sure that professional practice is free from prejudice and discrimination, but also encourages practitioners to challenge discrimination when they see it. And the key things here is that professionals need to address their own potential prejudices. They need to understand different cultures, the diversity of society. They need to challenge any discrimination they encounter or they witness, and also they need to provide compensation for the negative effects of discrimination. So that might be providing additional support to particular groups who are likely to face prejudice or discrimination. So for example, additional support in terms of employment or gaining employment for people with disabilities because they are likely to experience discrimination. Another key thing to look at is empowerment. And empowerment is making sure that you support people and allow them to take control of their lives, but also take control of their treatment and care. So ways that you can incorporate empowerment and empower an individual is letting them express their needs and preferences, promoting their independence, providing support in line with their beliefs and wishes, letting them have choice of services, putting them at the heart of service provision, and keeping them informed. There are some downsides that come from empowerment. So there are high demands of care that may not be able to be delivered. You might also find that there are medical practices which go against the care value. So for example, allowing someone to refuse a blood transfusion which would be necessary to save their life. When you promote individualized care, you are empowering an individual. You're tailoring the care to their specific need. You're making them feel valued. And again, this can help people overcome issues like if they've lost confidence or they feel unsupported in society. Empowerment will provide some compensation to those feelings and attitudes. It also is really important for self-esteem. It raises an individual's self-esteem, their self-respect, their confidence, and their self-worth. And by boosting this self-esteem, it will encourage them to make progression with their recovery and their treatment, keeps them involved in the care plan, keeps them informed, they know what is happening, gives the individual an element of control, so they feel that they have some control over their treatment, their care. And again, that's going to add to their self-esteem. They're going to feel valued and important. If their condition is quite severe, they might lose a sense of identity. So by letting them have some control in the care plan, it gives them some control over their illness. And lastly, empowerment means that an individual is more likely to be treated as an individual with their preferences and values respected. And ultimately, it increases independence. So professionals can empower people in lots of different ways. An occupational therapist can help someone have more control over day-to-day activities. Midwives can empower newborn mothers and help them with postpartum depression, help them how to schedule their time, how to care for their baby, how to maintain their independence. Healthcare assistants might allow an individual to have some choice over what to wear, what to eat, how they're cared for. An occupational therapist, again we've mentioned, will work with lots of different people and support patients with routines. Doctors will help explain conditions, help discuss treatment options. We've mentioned midwives, again, different ways of maybe postpartum or antenatal care. Again, helping with pregnancies, and obviously a children's support nurse, for example, might give parents more support or choice, keep them informed of what's happening with their child. And it may even help children to understand what's helping or happening to them. And there we have it. So a little bit about responsibilities of those in care, particularly anti-discriminatory practice and empowerment. Again, hope this has helped. Thank you for watching. If you could like, subscribe, tell your friends, all those things would be greatly appreciated. And as always, thanks for watching and take care. Now, the first thing when you are working with people, you're helping them with their recovery and their healing following some kind of surgery or intervention. There are lots of different ways that you can do this. And obviously, to support the individual, you need to be aware of what has made them ill or what has led them to needing rehabilitation. There are lots of different ways of medical intervention that can be provided. For example, medication is a key one, traditionally provided by doctors, but nurses have undertaken additional training can also prescribe medication. Medication is really good for treating a range of different health conditions, and it has a number of pros and cons. So often trained professionals are providing it, they're diagnosing and prescribing the medication. Medication is often tested and therefore is generally excellent at treating conditions, but also generally can be seen as safe. That's not to say, as a downside, there are not side effects. Medication can provide side effects. The more medication you take, the more resilience you build to that medication. It can also lead to addictions. We often see misuse and misdiagnosis with medication, but also misuse of and over-reliance on what we'd call over-the-counter medication. So medications you can buy without a prescription, and again, some people can become addicted to those. Organ transplants are another way of intervening and helping someone with an issue. This involves removing part of the body or an organ from one individual and placing it or transplanting it into another individual, often to replace a damaged or missing organ. And lots of things can be transplanted. So it can be organs, tissues, bone marrow, blood, transfusions. There's lots of things that can be transplanted. Now, these can be really good for helping with a damaged or missing organ. The downside is that obviously there may be a lack of suitable donations, but also that there is a working life. For a lot of transplant organs, they have a lifespan. So for heart transplants, it may be 5 years. Kidneys will last for between 10 to 12 years. So again, these transplants are really good, but it means you might have to, depending on how young you are, you may have to have multiple transplants performed. Surgery is also another key intervention point. So again, this can help with physical disorders, physical issues, and it can be used for removing tumours or cancerous growth. It might be repairing damaged organs or systems. So it is a physical and quite invasive form of surgery. Now, trained professionals perform this surgery. They can fix an issue. Techniques have improved, which have made surgery safer, quicker, easier, but they do come with longer recovery times and need for rehabilitation. Charity groups are also really important, again, when aiding recovery and rehabilitation. These groups will be targeted towards particular individuals, particular groups, depending on their specific need or illness. Support groups can be helpful for dealing with an issue, and it can provide a form of support for individuals. However, a lot of charities rely on donations in order to provide their service. Radiotherapy, again, another form of treatment for cancer. It can be used in addition to chemotherapy or as an alternative to chemotherapy. It's a very focused, high-energy radiation that's blasted at a cluster of cancerous cells, and it's often quite effective at reducing or removing that cancerous cell. Now, it is very intensive, and but it's not as intensive as chemotherapy, but it's also not as efficient. It can also lead to localized tissue burns. Lifestyle change is probably the easiest and most common form of way of dealing with a health issue. So you change your patterns of life, your diet, your exercise, it might be your lifestyle, such as smoking, drinking, and almost overlapping a little bit of charities. There are support groups that can help you do this. Making a change is often a clear way of making health improvements. However, it may cost money and it does require self-motivation. And rehabilitation, as we mentioned before, rehabilitation isn't just about someone dealing with an addiction. If you are recovering from an illness, you are going through rehabilitation. So anyone who's recovering from an illness, an injury, or surgery, or some form of life change or illness, they have to go through rehabilitation. It's about trying to help them sort of return to normal life, to regain their independence. And this can be performed by lots of different groups like physiotherapists, occupational therapists, counsellors, psychologists. There are lots of equipments and pieces of training or resources that can be used to help with rehabilitation. And what I'm going to do is I'm going to put a big list of these on the next slide. So when you are enabling rehabilitation, there are lots of different ways you can do this. So you have the physical equipment that you can provide to an individual, and that might be equipment to improve mobility, or it might be appliances that help with daily living activities. So it might be mobility stuff like walking sticks, stair lifts, or it could be sort of special cutlery, feeding straws, raised toilet seats. So you can provide equipment, physical equipment, to help with the day-to-day. Technology is also a really big support system when you're helping someone to rehabilitate following an issue. So you get a lot of assistive technologies and tools that can help people with a disability. So it might be adaptive keyboards or computer screens. It could be wheelchairs that can be accessible into learning spaces or have ability to be connected to laptops, so users can use screens and textbooks. Providing personal care is a big part of rehabilitation, so helping people with washing, toileting, feeding. It does overlap a little bit with the kind of providing equipment for day to day. But if you're in domiciliary care, where people come and care for you in the home, it might be adaptations made to your bathroom or your bath, your toilet, to help people to perform those daily tasks or be assisted with those daily tasks. If it's an awareness, again, health providers need to be aware of different cultural and religious practices. So for example, when it comes to washing, if you come from obviously a Muslim or Hindu background, you may prefer to wash with running water than have a bath. You may prefer to use bidets rather than toilet paper. Avoid having haircuts. Again, your diet is also going to be affected by your religion. So if you're vegetarian, a vegan, Muslim, Jewish, Hindu, your diet is going to be affected by that. And last but not least, again, the routines. Service providers are there to help with routines, to help with stuff like employability, taking part in leisure activities. So the more informed a carer is, the more support they can provide. And again, you may want to take a screenshot of this as just some examples of ways that rehabilitation can be provided, how an individual will be helped to rehabilitate. So as always, thank you for watching this video. I hope it's been of some help, particularly with revision for exams or assessments. As always, can I ask, obviously, please like the video if you found it helpful. Tell your friends and let them know what's happening here. If you can subscribe, that'd be amazing. And thank you for watching. Hope you have a good day and take care. So when it comes to ensuring safety, this is an essential feature of health and social care. Any health and social care setting is a legal right to ensure that anyone in that setting is protected, and safety is a really important aspect of working in healthcare. The first of these is a risk assessment. So the first thing most healthcare settings, or all healthcare settings, do will be a risk assessment. Now, a risk assessment is basically a way of identifying potential risks or hazards that could cause harm to an individual in your setting, and then putting actions in place to reduce the impact of that risk. A risk is essentially how likely someone is to come to harm, and obviously will be harmed by a hazard. Hazards are anything that could be dangerous. So this could be stairs, cables, it could be how waste is handled and disposed of. Anything that's a source of danger is a hazard. You assess the level of risk, of likelihood of that causing harm, and that's where a risk assessment comes from. It's the responsibility of employers to ensure that health and safety is really protected when working in healthcare settings. The Health and Safety Work Act of 1974 ensures that all employers and employees must maintain a safe working environment. As part of this, employers need to make sure that they have a health and safety check. They need to be doing these risk assessments, looking for any potential hazards, sources of danger, and they need to update these records regularly, keep staff updated of assessments, risk assessments, and make sure they provide training to protect all their workers, as well as record any accidents that have taken place. Employees also have an important role when it comes to preventing risk and injury. So employees must take responsibility of their own safety. They must be aware of these risk assessments. They need to identify their own risks and report and update these risk assessments as they go. If they find damaged equipment, anything that's at risk to other workers, they have to report it. So therefore they're protecting others, people, as well as themselves. When it comes to protection from infection, another part of keeping people safe, there are two aspects to this. So there might be the clinical waste side of protection from infection. So workers who are handling blood, urine, saliva, other bodily fluids that could be a source of infection. The best way to do this is to wear PPE protection, wash hands, keep soiled equipment separate from clean materials, store them away or dispose them. So for example, like protective gloves or needles or syringes are put into sharps boxes, which are often yellow, and then are incinerated. So this is all about keeping surfaces clean, wearing protective clothing, washing hands to prevent the spread of infection or disease. Hazardous waste, on the other hand, these are substances which are slightly more harmful. So this could be equipment, this could be soil dressings, this could be flammable or explosive materials that people may handle. It could be poisons, it could be corrosive. So it's anything which could harm someone. And it isn't just necessarily medical waste, but these could be chemicals or a piece of equipment that people use. So again, in the case of hazardous waste, these will need to be disposed of properly, and this could be in the same way as clinical waste, where biological matter is put into yellow bags and incinerated. Soiled laundry will be put into red bags, which are then washed at incredibly high temperatures to kill any bacteria. Blue bags might be for medical equipment that needs to be sterilized and repackaged for further use. So this policy comes under control of substances hazardous to health, or the COSH regulations, which are really important for helping to keep control of anything that could be harmful to individuals. And effectively, in most cases, these substances are just destroyed and incinerated. Further to this, we have lone worker policies. So essentially, any setting where a care worker or some kind of care professional is going to be working on their own, often happens with domiciliary care, where a care worker goes into a person's home. Again, a lone worker policy would need to be put in place. Lone worker policies generally cover a lot of what we've already mentioned: risk assessments, COSH training, but it also covers stuff like making sure equipment has been provided, that health and safety is met in terms of providing first aid training, first aid equipment. So this comes under the care manager's responsibility. So any care manager sending staff to work on their own in a setting needs to make sure they're providing those resources, that equipment, that training, and those checks. Safeguarding is another really important part of protecting people, ensuring safety. So this is about identifying potential risks, looking at whether people are experiencing harm, abuse, neglect, and essentially having a safeguarding policy in place in which you are protecting the people you're working for. So a health and safety policy often will have links to safeguarding, where you are protecting the clients, the people. And it's more about identifying or observing any potential signs of abuse, neglect, or potential risk, and reporting it to a safeguarding officer who will pass it on, depending on the age of the person. So if it's children, it might be going to maybe potentially police or other agencies, but essentially you're protecting people. When it comes to accidents as well, we have to make sure we are reporting them. So any accident needs to be reported. We use this system called RIDDOR. So it's the reporting of injuries, diseases, and dangerous occurrences. It was introduced in 2013. So essentially, any injury, any accident, anything that happens in the workplace which needs to be recorded. And when you do this, you record the date, the time, what the hazard was, who was affected, how they were affected, and essentially this needs to be updated. When the CQC, when any regulator will come in to do inspections, this will be something they want to see. Because again, it highlights that if you've got lots of accidents happening, it suggests maybe your risk assessments, your health and safety training, your setting is not suitable for what's needed. And also provision of first aid. So if you are providing a service, you need to make sure you have first aid facilities or first aid trained individuals in order to carry out immediate medical care if someone becomes injured or hurt in your setting. This would also then be followed up by recording the incident on the RIDDLE report. And last but not least, the other ways we keep people safe. So we need to have a complaints procedure. Any setting which works, people will have a system in which people can make complaints. Now, this is probably sometimes if someone is not being treated properly, if there are safeguarding concerns, safety concerns, and patients feel threatened or under sort of not being protected, this is a good way to make sure that those concerns are raised and addressed. Often if someone makes a formal complaint or a complaint, they have to be dealt with quickly. They have to show outcomes have been met or concerns have been acknowledged. And essentially, again, this will be something else that CQC and inspectors will look at. Is there a complaints process? Are people making complaints? Are they being dealt with? Not a specific safety feature, but again, allowing someone to make a complaint about the quality of care could be a way of making sure that people are protected from injury or maltreatment. And so again, complaining is really key. We also have whistleblowing, which links to this. So again, it's part of the complaints process. If you make a formal complaint, you don't feel it's been addressed or dealt with, you can then seek the support or report it to other external agencies. That might be your regulatory body like GMC, NMC, HCPC. It could be going to the police, it could be going to the press, but essentially the goal is you're trying to bring about improvements and change. And finally, confidentiality. Confidentiality is part of this ensuring safety. You keep people safe by keeping their data safe. So one of the things about recording and storing data is that we need to make sure that we have systems in place to keep data safe, protected and confidential. And essentially, we shouldn't have people looking at data that isn't up to them, or they shouldn't have any right to access. So this will all be coming under the storage information, but also the legal principles, the Data Protection Act, GDPR. These policies are important for keeping people's data safe in order to protect their data, their information about them. Okay, hope this has helped. So this is an overview of how to keep people safe in settings and also the importance of ensuring safety. As always, I hope this helps. Like and subscribe, tell your friends, all those good things. Thanks for watching. So the main differences we see here is that a law or an act or a piece of legislation is something created by Parliament that creates a new law or changes a law that is already in place. Policies, on the other hand, are detailed descriptions of how often a centre or a client should act in order to correspond with the law that's been put in place. And procedures are the written instructions given to staff, and it's kind of the expectations, the things that they should be doing as part of their role in order to meet the policy. So essentially the main difference is the law is what the government says you should do. The policy is how a setting says they are complying with the law and what they expect to be done at the setting. And then the procedure is the way in which staff perform their role and they are complying with the policy. So there are three different kind of things: the idea, the expectation from the government, what the setting says it's going to do, and how the staff are expected to behave. Some of the laws that will come up quite frequently within health and social care that apply to a lot of the materials in the second year unit would be this first two, which is the Health and Safety Act and then the Health and Safety First Aid development of that law. The main health and safety is about trying to keep employees safe, protect clients, visitors, the public, mainly suggesting you carry out risk assessments to reduce the level of accidents. The Health and Safety Edition requires that you have to have appropriate and adequate first aid provision in case of an accident. All accidents should be logged. The Human Rights Act is an older policy. It's quite general to society. It's about giving people equality, fairness, dignity in a range of different areas of life, but it does overlap and come into elements of healthcare. The Data Protection Act in 1998, which was replaced in 2018 by GDPR, or General Data Protection Regulations. Essentially, it's about keeping information private, confidential, safe and secure, and essentially making sure that any information that is passed between different agencies, different professionals, is accurate and only passed if necessary and securely. The CRB, or Criminal Records Bureau checks, which were introduced in 2002, were replaced in 2012 by the Disclosure and Barring Service, or DBS. Essentially, organisations have to run a background check on anyone working within them, more so to do with people with vulnerable positions or health or education, and generally healthcare settings. Most professionals, most people working within them will have this check completed. Every Child Matters was introduced in 2003 following a number of child protection issues such as Victoria Climbié and Baby P. The main element of this is that all children have to have a chance to reach their full potential, reducing levels of ill health, eradicating abuse and neglect. The outcomes are always about staying safe, enjoying healthy, active life, making positive contributions and positive economic well-being. Children's Act kind of develops on from this 2004, providing this duty to cooperate. So all services who concern for a group of people, if they have safeguarding concerns, have to share them, and they can't hold on to that information themselves. RIDDOR, or Reporting of Injuries, Disease and Dangerous Occurrences, again is more about the way that you're required to record any kind of illness. It's very similar to the sort of first aid, health and safety elements. Equality Act, which comes up a lot, treating everyone equally and fairly. The Lone Worker Policy, which links to professionals who are working on their own within a setting, so it could be going into someone's home, on a ward, and again it's about promoting safety, reducing risk to staff. COSH, which is the Control of Substances Hazardous to Health, is about handling chemicals and biological products. And lastly, provision of equipment. So essentially, employers have to provide equipment to staff to ensure they can perform their role safely. Now, how these laws relate to policies means that a lot of them combine together. So if we look at the equality and diversity policy, generally most institutions will have an equality and diversity policy of some name or variation of this name. It's always about keeping and promoting equality in its working. This is influenced by policies like the Human Rights Act and the Equality Act. And when it comes to the procedure of how staff act, they have to undergo training on equality and diversity and agree and confirm they've taken that training. It's often regularly updated. There are punishments in place for anyone who breaks equality and diversity guidelines. There's lots of anti-discriminatory practice being promoted within a setting, and if someone wants to see or witness discriminatory practice, they have to report it. If they see someone acting in a discriminatory way, they have to report that. Another policy would be safeguarding. Safeguarding policy heavily influenced by policies such as the Health and Safety Acts, Children's Act and Equality Act. Ultimately, with all these policies, the idea links to making sure that staff are DBS checked, they're safeguard trained, and they have to have reviews in that. It's about making sure they're looking for signs of abuse and neglect, looking for problems, and also if they do spot them, they have to know the processes, who to report to, how and what needs to be done. The next one we have are health and safety policies. Health and safety policies relate to a lot of different policies on this list. So the health and safety ones, obviously RIDDOR, Lone Worker Policies, COSH and PUA. So again, all of these relate to the idea about making sure people are safe within the sector. The main way this is done by staff, the provision or the procedure, of how to do this is through fire training, risk assessments, food hygiene, having cleaning cupboards locked, making sure that any trip hazards are removed, making sure staff have training even on things like lifting patients or how to handle patients. So it's a range of different training to make sure that people, both clients and service providers, are kept safe. The complaints and whistleblowing policy is our next one here. Again, this will be influenced by policies like health and safety, equality, human rights. It's more to do with if you were to see some form of neglect or an issue that you didn't feel was being appropriately handled or a change was being made. It's making sure you know who to complain to, how to make that complaint. Is it informally written? Is it informally mentioned? Is that enough? And who you would go to if your complaint isn't responded to in a set amount of time. And the last policy here is confidentiality policies. So this is always linked to privacy. The policies that would influence us would be data protection or GDPR. GDPR is probably the better one to refer to because that's the most recent policy. Most textbooks refer to data protection because a lot of them were produced in 2016 before the policy was introduced. The way you would maintain confidentiality, the procedures you would use would be, electronic records. If you're passing these on, they're password secured. You're sending the information locked or secured, separate from the password. Paper documents are locked away and shredded after a period of time when they're no longer needed. Not having personal information on laptops or phones or devices that could be lost or stolen quite easily. And in terms of confidentiality and with data protection, it's also about making sure that information is accurate, is up to date, and so that you're not treating people inaccurately or wrongly because of outdated information. And there we have it. So this is the big differences between the laws, the policies that settings have, and then the procedures of how you would follow that policy or how you're demonstrating that you are complying with policy and the law. I hope this has helped a little bit with understanding. Questions occasionally appear asking about a policy or asking about procedures and asking you to identify differences between the two. So hopefully this might be used for that. As always, thanks for watching. Hope this helped, and keep an eye out for future videos.